Hi, welcome back. Today we are going to see the top 10 must know high yield NCLEX drug. Here we are going to see the high yield repeatedly the most tested in NCLEX examinations. And here I am going to give you a perfect quick revision what drugs we need to master in NCLEX exam. So let's go. First one is the cardiac glycoside. Here we are going to see digoxin. Yes, the key point what we need to remember is the therapeutic level of this particular drug. The NCLEX focuses here on the level, that is a therapeutic level of 0.5 to 2 nanogram per milliliter. And we need to hold this drug if the heart rate is less than 60 beats per minute. And always we need to monitor the toxic signs. Yes, the NCLEX focuses here on the nausea, the vomiting, or if the patient is having the green yellow halos. And bradycardia, of course, we cannot forget. Next one is the electrolyte risk. Here, if the potassium is low, the toxicity is very high. The electrolyte risk, we need to monitor the potassium. If low potassium, there is increase in signs of toxicity. The NCLEX trap here is if the patient is having normal digoxin level, it doesn't mean that the patient is safe. We should always monitor for the signs and symptoms of the digoxin toxicity. Next one is the anticoagulants and antiplatelets. Here we are going to see the two important drugs is the heparin and the warfarin. Here for the heparin, we need to monitor the APTT value, that is activated partial prothrombin time. And here the antidote what we give is protamine sulfate. And next one is warfarin. In warfarin, we are going to monitor the INR, that is 2 to 3 is normal, international normalized ratio. And the antidote what we give for warfarin is vitamin K. And direct oral anticoagulants. Here the main example is warfarin. Here we are not going to go by normal routine lab values. But of course we are going to monitor for any bleeding risk from the patient. The NCLEX trap here is the bleeding signs are more emphasized than the lab values. So we need to see the patient signs and symptoms. The next drug trap here is regarding the insulin types. Yes, we need to remember the insulin types. It is the most high yield topic in NCLEX. Here we are going to see the types of insulin, the example and the onset and the peak of action. First one is a rapid insulin. Here the example which we give is Lispro. The onset of action is 15 minutes and the peak it peaks till 1 hour. And next one is short acting insulin. Here an example is regular insulin where the onset of action is 30 to 60 minutes and it peaks to 2 to 4 hours. Yes. Next one is intermediate insulin. Here the example is NPH. Here and the peak onset of action is 1 to 2 hours and it peaks till 6 to 12 hours. Next one is type of insulin is long acting insulin. Here the example is glargine. Yes, the onset of action is 1 to 2 hours, but there is no peak for this drug. It acts for a longer time, more than 24 hours. Next, here the NCLEX trap, what we see is we should never mix glargine with any other insulin. It has to be given separately. The next important drug which is being tested is the beta blockers. It is, yes, ending with lol, metoprolol, propanolol, all these drugs comes under beta blockers. And the effect here is it decreases the heart rate and the BP. So the nursing point, what we need to monitor here is we are going to check the heart rate and the BP of the patient before administration of the drug. Yes, and it has a very high chances of masking hypoglycemia. So the patients who are having diabetes, we need to take a precautious action to say whether the sugars are falling. So we need to instruct them, diabetic patients, they should be aware of such drugs. And the main side effect of beta blocker is bradycardia. So the heart rate has to be monitored and any signs and symptoms of bradycardia has to be intimated and we have to withhold the drug. The NCLEX trap here is the patient is having asthma and we are giving beta blocker. We need to exercise caution and we never We should never give this beta blocker to the patient who is having asthma because this drug might exacerbate the asthma condition. Next one is the ACE inhibitors. Yes, this drug ends with the pril, enalapril, ketapril. All these drugs comes under this classification. What we need to monitor is the BP. Yes, once we give the first dose of the drug, always we need to monitor because there's high chances of hypotension. And next one is it increases the potassium. So it causes hyperkalemia. So we need to monitor the potassium level of the patient very keenly, and especially it has to be exercise caution when the patient is having renal impairment. Next key effect is the dry cough. It causes so much of dry cough, so it is very common in the patient when we are starting ACE inhibitors. And next important thing is angioedema. Whenever you see an angioedema in the patient who is taking ACE inhibitors, we need to stop this particular drug. Yes, it is very life-threatening emergency. So the NCLEX priority here is if there is any facial swelling or angioedema, it is a very high alert and we need to create an emergency and stop the drug. Next important topic is regarding the loop diuretics. Yes, the important drug here is the furosemide, that is the Lasix. The effect is the potassium loss. It is a loop diuretic, it causes potassium loss. So we need to monitor for signs and symptoms of hypokalemia. Next thing is we need to monitor is the dehydration. So we need to monitor the intake output chart when the patient who is getting Lasix injection or tablet. Next high risk is it causes ototoxicity. So this drug has to be administered very slowly via IV. It has to be given over 10 to 15 minutes, very slow IV. So the NCLEX trap here is whenever the patient has crackles and edema, we always choose a particular drug. Yes, that is loop diuretic. This condition significates respiratory condition, that is pulmonary edema. Next important drug we need to monitor is opioids. Yes, here we are going to see the drug that is morphine. The action is mainly it helps in pain relief. So we need to assess pain, that is the NCLEX point, and it focuses on it. The side effect of this is opioids can cause respiratory depression. So we need to monitor for signs and symptoms of respiratory depression if the patient who is on continued use of opioids. Next important thing is the antidote. We need to always remember a particular antidote, that is the naloxone. We need to keep it ready if the patient is having any signs of overuse. The NCLEX rule is if the patient is having a respiratory rate of less than 12 breaths per minute, please withhold this drug because it might worsen the respiratory condition of the patient. Next important drug we are going to see is benzodiazepine. Yes, it always ends in palm, alprazolam, diazepam. All these drugs come under this benzodiazepines. These are mainly used for anxiety and seizures to relieve all these symptoms of anxiety. The main risk here is again respiratory depression. So we need to monitor for respiratory depression. The antidote for this particular diazepam drugs is flumazil. So we need to keep this drug ready if there is an overuse of this particular drug. Next, the drug interaction here is when a patient is taking alcohol, please never give any diazepam along with it. Why? Because it can cause serious danger. So the drug interaction is with alcohol and diazepam, it can be a real threat to the patient. Here the NCLEX trap is we should never give benzodiazepine very fast IV push. Yes, it has to be given very slowly. Next important thing is what we are going to see is the antibiotics. Yes, in antibiotics we are mainly seeing the aminoglycosides. What happens is here is, for example, gentamicin, it causes a lot of nephrotoxicity and ototoxicity. The NCLEX priority here is we have to monitor for the blood urea nitrogen and the creatinine. It is the kidney function test. It plays a very important role when we are giving in these drugs. If these parameters are deranged, please withhold the drug. Yes. Next important drug we are going to see is the corticosteroids. Yes, corticosteroids is often tested because these drugs acts like an immunosuppressant. When the patient is on long corticosteroids, it can suppress a person's immune system, and this person might be risk for infection. So we need to teach a particular person what they have to be very cautious about when they are on steroids. And of course, this causes an increased surge in glucose level of the blood, and this might be very risk for the patient who is already having diabetes. So this has to be taken care when the patient is on corticosteroids. Under long term use, we should always remember these drugs has to be tapered very slowly, otherwise it can cause very serious effect. They can go for uh, adrenaline insufficiency. So the NCLEX trap here is never stop any corticosteroids abruptly. So the always an exam memory hack here is if the heart rate or the BP or the potassium, the bleeding and the breathing are being affected. Please remember, friends, these are the important parameters we need to see in the question. If these parameters are involved in the question, so the NCLEX always loves to test this particular aspects. If the drugs, any of these drugs which is mentioned is affecting all these above mentioned characters, any of the drugs which affects these features, then the NCLEX loves to test on this particular thing. Hope so. This particular topic is going to help you a lot in last minute revision. Thank you and happy learning.